Dear learners, today's MOOC will be on Unit 15, Nutrition and Gender, and Nutrition and Tribe from Module 5, Gender and Health. I am Rajmi Mahanta, Assistant Professor, Sociology Department, Krishnakanta Hendik State Open University. Now, let us look at the meaning of nutrition first. Nutrition is a process of providing or obtaining the food which is necessary for health and growth. And nutrients refer to the substances that provide nourishment which is essential for maintenance of life and growth. According to World Health Organization, nutrition is a critical part of health and development. Better nutrition is related to improved infant, child, and maternal health, stronger immune systems, safer pregnancy and childbirth, lower risk of non-communicable diseases like diabetes and cardiovascular diseases, and longevity. The most important nutrients in our food include carbohydrates, fats, proteins, vitamins, and minerals, roughage, and water. Nutrients are main source of energy. It helps in building and repairing tissues, provides structure to blood vessels, bones, ligaments, etc. Nutritional requirement differs with gender and age. If we discuss about nutrients in men, healthy diet meet their unique physical needs, fit their lifestyle, and reduce risk of cardiovascular diseases, type 2 diabetes, some cancers, and mental health issues. Younger men, generally between the age of 19 to 50, need more energy than older men, but still they are required to eat with moderation. A balance among 5 main food components must be maintained. An Australian dietary guideline suggests that having plenty of colorful vegetables, legumes, fruits, grains, meat, fishes and eggs, milk and milk products are essential. Men between the age of 50 to 71 require a less amount of certain foods from the above mentioned food items. Men above 71 requires calcium and phosphorus more. Eating dairy, eggs, sardines, rice, cashews, for example, helps with their health. Other than that, limiting alcohol intake and drinking plenty of water is necessary, not only in men but everyone in general. Now we will discuss about nutrition in women. Women's nutritional needs changes as their bodies change during various stages of life. Women's nutritional need change as their bodies change during various stages of life. During pre-teen years, girls need more calcium and vitamin D for strong bones to prevent osteoporosis later in life. During teen years, girls and young women need more calories for their developing bodies. Before and during pregnancy, certain nutrients like proteins, vitamins, calcium, iron, and folic acid are needed for mother and the baby's health. During breastfeeding, having adequate amount of water is very important. After menopause, lower levels of estrogen may cause chronic ailments like heart diseases, stroke and diabetes. An amount of calcium and vitamin D must be maintained for a good health. In this section, we will locate the factors that have an impact on the nutrition of men and women. Scientifically, for many nutrients, men and women have similar intake requirements, but some vary substantially. Males and females have different calcium and iron requirements. Folic acid needs vary for women depending on the phase of the life cycle. Women in childbearing years need 400 mg per day, but that increases to 600 mg per day for women who are pregnant. From sociological point of view, many of the factors responsible for differences in the quality and quantity of food that a household gives to male and female children are interlinked and can be traced to the values and ideas generated in the kinship system, family structure, and ideology linked to them. While men are encouraged to eat appropriately to fill their stomachs, it is believed that women can starve if they need. Women who might crave for food are laughed at by others and seen as greedy. Women and girls are not only the last to receive the food, but they also get less of it and of lower quality. Immunization rates are also very low for women. Many girls and women have high levels of anemia as a result of poor nutrition. Anemia affects pregnancy and increases the risk of maternal deaths. Meat is often made selectively available to males, and more specifically, preferred cuts of meat are reserved for them in some cultures. Physical strength, an attribute more characteristic of males, requires optimal nutrition, and meat is often seen as the most nutritious and strength-inducing food. Customarily, in many places, a girl is not given milk to drink. This is a typical pattern among Marathas and Brahmins in western Maharashtra and is, in fact, a general feature of Indian culture except among educated upper middle class and well-to-do sections. Women are entitled to milk only in special circumstances such as lactation or illness and sometimes pregnancy. An undernourished mother inevitably gives birth to an undernourished baby, perpetuating an intergenerational cycle of undernutrition. The cycle can be compounded further in young mothers, especially adolescent girls who begin childbearing before they have grown and developed enough. Differential access to nutrition and health. In the previous class, we mentioned about the problems in access to health care. Now, we will discuss it in details. First, we are going to look at the issues suffered by women. Number 1, limited decision-making power. Women generally and specifically in South Asian countries have very less or no decision-making power within the families, especially in the rural areas. They are not able to decide who to marry, and when to give birth. Early marriage and childbearing pose health risks like complicated pregnancies, unsafe child deliveries, and miscarriages. Many women also do not have access to abortion facilities. Number 2, time constraint. Most women are busy with household chores throughout their day, and in urban areas they do double duty in the sense that they have to work both outside and inside their homes. They hardly find time to take care of themselves, and going for health checkup is considered non-important. For many women, they are dependent on their husbands or other family members to take them to hospital. Number 3, intimate partner or domestic violence. It includes domestic violence, trafficking of women, rape, sexual harassment, female infanticide, female genital mutilation, dowry, and honor killings. Many women face intimate partner or domestic violence at the hands of their partners and families, which impact their physical and mental well-being. Number 4, economic reasons. In many countries, although public healthcare facilities exist, they are overloaded and people have to rely on private healthcare. However, it is expensive and not accessible to people from all classes and genders. Since women are not seen as equal members of society, their health needs are not considered as essential as men's and children's, and when there is money involved, their health issues are even more neglected. The last one is health system barriers. WHO, or World Health Organization, defines health system as all the activities whose basic function is to promote, restore, or maintain health. Women in most places need more health services than men but do not have access to them. These barriers are a reflection of women's low position in society. Many women treat pain as a minor inconvenience and do not see it as a health issue that needs medical treatment. Many women do not talk about their health issues because it might mean lower chances of marriage. Women in some situations are reluctant to use existing healthcare services because the overcrowded health systems do not ensure respect, privacy, and confidentiality about the treatment. Now, let us look at some of the factors that impact men's access to nutrition and healthcare services. Number 1. Notion of masculinity. Rigid gender norms and the idea of masculinity that exists in every society act as a barrier in men's access to proper healthcare. Characteristics associated with masculinity like toughness, control, strength, etc. govern men's bodies and emotions. They are taught to see themselves as strong, and hence a lot of times they do not seek help from doctor. In cases of issues related to mental health, men's suppression of their needs is even more as it involves emotions. Number 2, health system barriers. The health system itself, particularly in India, act as a barrier for men to access healthcare services. Shortage of human resources for health and lack of gender sensitization among health workers, especially about men's health, means that men do not feel comfortable seeking medical help. This is all the more true when it involves mental and sexual health. The staff in most hospitals, private or public, are not sensitized to handle gender-based health issues. Reducing gender bias in health system needs systematic approaches to generating awareness and changing values among service givers, processes to enhance healthcare facilities and operative apparatus for accountability. Attempts by government. In this section, we will discuss about various initiatives taken by government to promote healthcare services across the country. First, National Rural Health Mission. National Rural Health Mission is an Indian health program for improving healthcare delivery across rural India. It was launched to address problems prevailing across the country in the primary healthcare system. The mission aims to provide universal access to equitable, affordable, and quality healthcare that is accountable and at the same time responsive to the needs of the people. Next, National Urban Health Mission. The National Urban Health Mission will meet the health needs of the poor, particularly the slum dwellers, by making available to them essential primary healthcare services. This will be done by high caliber health professionals, appropriate technology, and health insurance for urban poor. Next, health and wellness centers. India has about 76,000 health and wellness centers which perform screening of 5 types of health issues: hypertension, diabetes, breast cancer, oral cancer, and cervical cancer. Next, we have Adolescent Friendly Health Services Program, Rashtriya Kishore Swasthya Karyakram, which is a program where female adolescents are made aware about their health. Next, Janani Suraksha Yojana. Janani Suraksha Yojana is a safe motherhood intervention under the National Health Mission. Next, Pradhan Mantri Matru Vandana Yojana. It is a scheme for pregnant women and lactating mothers. It is a direct benefit transfer scheme under which cash benefits are provided to pregnant women in their bank account directly to meet their enhanced nutritional needs and partially compensate for their wage loss. Then we have Emergency Response and Health Systems Preparedness Package. Public health and hospitals. Being a state subject, the primary responsibility for strengthening public healthcare system lies with the representative state governments. Next, we have Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. It has been designed to provide financial risk protection against catastrophic health expenditure that impoverishes an estimated 6 crore people every year. It provides a cover of Rs 5 lakh per family per year for secondary and tertiary care hospitalization across public and private MPELT hospitals in India. It also has provisions for cashless access to healthcare services. Then we have Pradhan Mantri Swasthya Suraksha Yojana. Its objectives are to correct regional imbalances in the availability of tertiary healthcare services and to augment facilities for quality medical education in the country. There are 2 components in it: setting up of new aims like institutes and upgradation of existing government medical colleges. Then we have efforts of Ministry of Ayush. The rapid growth of Ayush sector, scientific cultivation of medical plants, expansion of Ayush education and health infrastructure, skill upgradation, and global acceptance of yoga and Ayurveda have opened up new opportunities for revenue and employment. Now we are going to discuss our next topic, which is nutrition and tribe. Widespread poverty, illiteracy, malnutrition, non-availability of safe drinking water and sanitation, unhygienic living conditions, poor maternal and child health services, ineffective coverage of national health programs and consanguineous marriages have been found to affect the health status of tribal community adversely. Following are some of the most important causes of nutrition and health issues in tribes. The common belief, customs, and practices connected with health and diseases influence their choice of treatment methods. Every cultural system has their concept and beliefs of health and illness. Accordingly, they have their own health practices. Transition from the customary worldview to the modern one becomes difficult unless sustained efforts are made in this regard. Next, lack of education, problem of illiteracy, and unawareness of efficiency of modern medical system. This also hinders the tribal people to access the modern health system. Literacy and education serve as facilitators in understanding and accessing of the benefit of the modern health system. The inadequate nature of facilities in many tribal areas, the lack of understanding in the staff providing these facilities for the indigenous culture, and further inadequate attention towards their patients are also important causes of difficulties in accessing healthcare for the tribal people. Type of diseases affecting tribal people. Number 1, anemia. Lack of nutrition and anemia are major problems for women in India, and more so in the rural and tribal belt. Anemia lowers resistance to fatigue, affect working capacity under conditions of stress, and increase susceptibility to other diseases. Tribal diets are generally grossly deficient in calcium, vitamin A, B, C, and animal protein. Next, various tribal groups in India have special health problems and genetic abnormalities like sickle cell anemia, G6PD, red cell enzyme deficiency, and sexually transmitted diseases. Apart from genetical factors, unsanitary conditions, ignorance, lack of personal hygiene, and health education are main factors responsible for majority of health problems. Similarly, crude birth practices are found to exist in some tribal groups like the Khariyas, Gons, Kutia, Kons of Orissa, Santals, Jonsaris, etc. More than 90% of the deliveries are conducted at homes by elderly ladies of the household. No specific precautions are observed at the time of conducting deliveries, which result in an increased susceptibility to various infections. These practices also increase the risk of mother-to-child transmission of diseases like HIV/AIDS. Malnutrition has been common, and it greatly affects the ability to resist infection, leading to chronic illness, and during the post-weaning period, it leads to permanent brain impairment. Tribal people have over the centuries developed their own medicinal system based on herbs and other items collected from nature and processed locally. The indigenous medical system of the tribal people is also known as ethnomedicine. They have also built their own system of diagnosis and cure of diseases, but the skills as well as the natural resources are fast disappearing. Moreover, the traditional systems cannot treat or prevent many of the diseases that modern medicines can. The following are the actions which are proposed to be taken in the national policy which would ensure proper access to healthcare services by the tribal people. Efforts will be made to devise new systems or patterns of institutions by which the access of tribal people to modern healthcare would be enhanced. The synthesis of Indian systems of medicines like Ayurveda and Siddha with the tribal system and modern medicine will be promoted. Poor quality of drinking water and lack of awareness about hygiene and improved sanitation are major sources of waterborne diseases. Since tribal areas have different kinds of terrain, different methods of provision of drinking water will have to be adopted. Most of the tribal areas have sufficient rainfall. In the plain areas, bore wells and tube wells would be sufficient. In the uplands, it will have to be deep wells with higher estimates. The government will endeavor to improve health, drinking water supply, hygiene and sanitation among the scheduled tribes. With that, we have come to the end of today's class. Now let us sum up the key topics that we have discussed so far. We discussed two topics, that is nutrition and gender and nutrition and tribes. Under the first topic, we discussed about the meaning of nutrition, type of nutrition necessary for men and women. Then we discussed about the barriers that exist while accessing health and nutrition. We ended the topic with the discussion of various government initiatives regarding it. In the second topic, we discussed about the causes of nutritional and healthcare disparities in tribes, types of diseases and proposed actions to counter them. With this, we have reached the conclusion of today's class. Thank you.